Regular mammograms are every woman's secret weapon against breast cancer. This 5-minute screening is considered by most medical professionals as the most powerful way to catch early breast cancer and save lives.
Approximately 180,000 women will be diagnosed with breast cancer this year. Of those, approximately 40,000 will die of the disease.
But doctors remind us that getting breast cancer doesn't have to be a death sentence. That is, if you catch it early. And the best way to catch it early is to have regular mammograms.
In the Latina population, the incidence of breast cancer is actually slightly lower than the general population. However, the prognosis, or how the patients do with the disease, is slightly worse than the overall general population. And the reason for that is that the time of diagnosis, the stage at which the patient is being diagnosed, is slightly later in Hispanic women, and they tend to do worse with the disease because of that.
He's saying many Latina women are dying unnecessarily because too many don't get regular mammograms.
One of the reasons why, for many reasons, why Latina women don't get their screenings done on time or let them just go by the wayside would be because they always tend to put their families first. Their children come first, the rent comes first, the grocery bills come first before themselves. I think we need to, as Latino women, remember to put ourselves first, because if we don't take care of ourselves, then we won't be there for our families in the days to come.
Doctors are trying to get the message out. Your best insurance is a mammogram.
A mammogram is a special X-ray of the breast, and the X-ray is designed specifically to evaluate for breast cancer. Mammography is one tool that we use, but it's still the gold standard for the early detection of breast cancer.
I wasn't quite sure what it entailed. I didn't experience a mammogram, and no one had ever talked to me about a mammogram and what to expect. Turns out it was a basic, simple procedure. It's a matter of 3 minutes they can get it completed and done. And I didn't feel much pain.
You don't need to prepare for a mammogram. You can eat normally and take medications. Some doctors will tell you to take a painkiller before your exam to help minimize any discomfort, and you will be given some instructions.
So the day of the mammogram, patient needs to be aware that they cannot use any perfume, powder, or deodorant, as this may complicate the imaging by causing an artifact on the film. Otherwise, no other preparation is needed.
Once checked in, you'll undress from the waist up and wear a special robe. A mammography technologist will perform your mammogram by positioning your breasts between two firm surfaces that compress or basically squish your breast as flat as possible to take good X-ray pictures.
2 views of each breast are obtained at a minimum. Those images are shown to the radiologist, and a decision is made whether any additional imaging needs to be done. The procedure takes approximately 10 to 15 minutes to complete. And generally the physician will get the result within the next 24 to 48 hours.
Most abnormalities found during a mammogram are not breast cancer. But for the hundreds of thousands of women a year who hear the words, "You have breast cancer," studies have shown a mammogram picking up breast cancer early, combined with breast cancer therapies, are the reasons more and more women are surviving breast cancer. Just ask Monica Olmos. She had her first mammogram when she found a painful lump in her breast. Doctors first removed the lump and ultimately her entire breast.
I didn't read much about what a mastectomy involved, but at that point I told them without hesitation, do what you must, just save my life. Take what you need to do and just save my life. And so the subsequent surgery that occurred was the mastectomy.
Monica's prayers, along with a 1.5 years of chemotherapy and radiation therapy, paid off. She's been cancer-free for more than 6 years.
The sooner and earlier you find it, the best results. But mammogram is by far what I scream out to women. Get a mammogram. You feel a lump, it feels abnormal, it doesn't feel like your body, you notice something changing, a little minor change, get a mammogram. Even if there is no history in your family.
Experts have different recommendations about how often you should have a mammogram. Some doctors will say you should get a screening mammography every year beginning at age 40. Others will say you don't need yearly screenings until you're 50. And some doctors will recommend a baseline screening around the age of 35 to have images of your healthy breasts to compare changes later. If you have a family history of breast cancer or other risk factors, talk to your doctor about when you should start scheduling a yearly screening. And as good as mammograms are, they can still miss 15 to 20% of breast cancers. So here's the key. Do monthly self-breast exams to see if there are any changes in your breasts starting in your early 20s. If you notice a lump, pain, dimpling of the skin, a change in the shape of your nipple, a blood-stained discharge, or a swelling or lump in your armpit, see your doctor right away. Now, don't let cost be the reason you don't get your breasts screened. Most insurance companies cover the cost of mammograms, as does Medicare. But there are options for women who don't have insurance and can't afford one.
If you can't afford a mammogram, there are organizations out there that can help a woman with the funds necessary to get a mammogram done. And places like that are like the Susan G. Komen Foundation. That's one of the principal places, not only in California, but as well as on a national level.
To find out how to get a low-cost or free mammogram or to find a certified radiology center in your area, call the Susan G. Komen for the Cures Breast Care Helpline or the National Cancer Institute. You can also ask your doctor or local health department for referrals. For more information, click on the Resources tab on Saber Hacer. Don't wait to take this life-saving screening. You owe it to yourself and your family.